Golfer's elbow, or medial epicondylitis, is a condition that causes pain and inflammation on the inside of the elbow. Despite its name, it isn't limited to golfers. It can affect anyone who performs repetitive wrist and forearm motions, such as tennis players, baseball players, or those who do activities like manual labor or typing. Symptoms: the main symptoms of golfer's elbow include pain and tenderness. Pain is typically felt on the inner side of the elbow, extending along the forearm. The pain may worsen with certain movements, such as gripping or lifting. Stiffness. The elbow may feel stiff, and it may be hard to make a fist. Weakness. Weakened grip strength in the hands or wrists can occur. Numbness or tingling. Sometimes, there may be a sensation of tingling or numbness radiating to one or more fingers, especially the ring and little fingers. Causes: golfer's elbow is caused by overuse or repetitive stress, which results in tiny tears in the tendons that attach the forearm muscles to the elbow. Activities that involve repetitive wrist flexion, gripping, or throwing can strain these tendons, leading to inflammation and pain. Common causes include golfing, gripping or swinging a club incorrectly, tetanus, particularly with improper technique, throwing sports, like baseball or javelin, manual labor, repetitive use of tools, such as hammers or screwdrivers, computer use, long periods of typing or improper hand posture. Risk factors: you are more likely to develop golfer's elbow if you engage in repetitive wrist or forearm activities, use poor technique in sports or manual tasks, lack proper strength or flexibility in your forearm muscles, are 40 years of age or older. Diagnosis: a doctor will typically diagnose golfer's elbow based on a physical exam and a review of your medical history. They may check for tenderness in the inner elbow and ask you to perform certain movements that trigger pain. In some cases, imaging tests like X-rays or an MRI may be used to rule out other conditions, such as fractures or nerve compression. Treatment: most cases of golfer's elbow can be treated non-surgically. Common treatments include rest. Avoid activities that aggravate the pain to allow the tendons to heal. Ice. Apply ice packs to the affected area for 15 to 20 minutes, several times a day to reduce inflammation and pain. Pain relievers. Over-the-counter medications like ibuprofen or naproxen can help reduce pain and swelling. Physical therapy. Stretching and strengthening exercises can help improve flexibility and strength in the forearm muscles. A physical therapist can also recommend exercises to correct muscle imbalances and improve technique in sports. Brace or support. Wearing an elbow brace or counterfore strap can help reduce strain on the tendons by distributing the pressure more evenly across the arm. Corticosteroid injections. In severe cases, the doctor may recommend an injection of corticosteroids to reduce inflammation. Shockwave therapy. Some cases of chronic golfer's elbow may benefit from extracorporeal shockwave therapy (ESWT), which uses sound waves to stimulate healing. Surgery is rarely needed for golfer's elbow, but in cases where non-surgical treatments don't provide relief after 6 to 12 months, surgery to remove damaged tissue may be considered. Recovery from surgery typically involves physical therapy to restore strength and range of motion. Prevention: to prevent golfer's elbow, consider the following tips. Warm up. Always warm up before engaging in any physical activity. Stretch your forearm muscles before and after exercise or repetitive tasks. Improve technique. Proper technique in sports and activities like golf or tennis is essential. Consider working with a coach or trainer to refine your form. Strengthening exercises. Strengthening the muscles of your forearm can help prevent strain on the tendons. Focus on both wrist flexors and extensors. Take breaks. If your job or hobby involves repetitive wrist and forearm motions, take frequent breaks to avoid overuse. Use proper equipment. Ensure that your equipment, such as golf clubs or tennis rackets, is the right size and weight for you. Conclusion: golfer's elbow is a common condition that can cause significant discomfort, but with rest, treatment, and preventive measures, most people recover fully. Early treatment is key to preventing long-term damage or chronic pain.